Welcome back to the channel. In this video, you'll learn what anxiety disorder really is, and why does it happen in the brain and body, the causes and triggers, warning signs you should never ignore, and treatment options available. What if the constant worry you feel isn't just stress? What if your racing thoughts, restless nights, and physical tension are actually signs of something deeper? We're breaking down anxiety disorder, what it is, why it happens, and how you can take control of it. Anxiety is a natural response to stress. It's your body's built-in alarm system. But when anxiety becomes persistent, excessive, and interferes with your daily life, which may develop into an anxiety disorder. This includes conditions like generalized anxiety disorder, GAD, panic disorder, and social anxiety are distinct but often comorbid mental health conditions characterized by excessive, uncontrollable worry or fear that disrupts your daily life. GAD involves chronic, generalized worrying about your daily life. Anxiety originates in the brain, particularly in areas that control fear and emotional response. When your brain senses danger, it activates the fight or flight response, releasing stress hormones like adrenaline. The problem? In anxiety disorders, this system becomes overactive, even when there is no real danger. Anxiety disorders are usually caused by a combination of factors. The biological factors of anxiety disorders include genetic predisposition, neurotransmitter imbalances, serotonin, dopamine, GABA, norepinephrine, and structural brain changes, specifically an overactive amygdala. These factors often create a heightened physiological stress response, HPA axis activation, leading to chronic anxiety symptoms and increased susceptibility, often termed neurobiological mechanisms or genetic risk factors. Brain chemistry imbalances in anxiety disorders involve irregular levels of neurotransmitters that regulate mood, stress, and calm, primarily characterized by reduced GABA, inhibitory calm, lowered serotonin, mood regulation, and elevated norepinephrine, fight or flight response. These imbalances, often linked to lowered brain choline levels, affect neurotransmission between brain regions like the amygdala and prefrontal cortex. The genetics factors of anxiety disorders involve a moderate, polygenic, and inherited predisposition, with studies estimating 30 to 60% heritability. Key genetic components involve variations in serotonin, catecholamine, and neurotrophic systems, specifically genes like 5-HT-TLPR, MAOA, COMT, and RBFLEX1, which often interact with environmental factors. The psychological factors of anxiety disorders include traumatic life experiences, cognitive distortions, such as catastrophizing and rumination, high neuroticism, and poor emotion regulation. Traumatic and adverse childhood experiences. A history of abuse, sexual, emotional, physical, or neglect significantly increases the risk. The key, addressable risk factors include severe long-term stress, low self-esteem, and perfectionism. The negative thinking patterns in anxiety disorders, often called cognitive distortions, are irrational, automatic thought processes that fuel fear and dread. Common types include catastrophic thinking, expecting the worst, mind reading, assuming others think negatively of you, and emotional reasoning, believing feelings are facts, as described by. These patterns, also known as irrational beliefs or cognitive biases, often include all-or-nothing thinking and personalization. Trauma or past experiences are major drivers of anxiety disorders, often causing the brain to remain in a heightened state of fear or hyperarousal long after a danger has passed. These experiences, including childhood abuse, neglect, or adult trauma, can rewire neural pathways, leading to chronic anxiety, panic disorders, and PTSD. Environmental factors are chronic stress, lifestyle habits, and substance use, like caffeine or alcohol. It's rarely just one cause, it's a combination. Emotional symptoms, like constant worry or fears, irritability, and feeling overwhelmed. Mental symptoms, like overthinking and difficulty concentrating. Physical symptoms, like rapid heartbeat, constant shortness of breath, muscle tension, and trouble sleeping. These symptoms are real, and they are your body asking for attention. The good news is that anxiety disorders are highly treatable. Therapy is the first line of treatment. Cognitive behavioral therapy, which is one of the most effective methods to help you identify your negative thought patterns. It helps individuals identify and challenge unhealthy, automatic thoughts and replace them with realistic, positive ones to manage emotions and improve coping skills. It focuses on the link between thoughts, feelings, and actions, providing tools to handle stress, anxiety, and challenging life situations. Doctors may prescribe medications such as sertraline or fluoxetine. Sertraline. It is used to treat anxiety disorders, including generalized anxiety, social anxiety, and panic disorder. It works by increasing serotonin levels in the brain to improve mood and reduce anxiety, often showing benefits within 6 weeks. Fluoxetine, commonly known by the brand name Prozac, is commonly prescribed to treat anxiety disorders by increasing serotonin levels in the brain. It is FDA approved for panic disorder, obsessive-compulsive disorder, OCD, and often used off-label for generalized anxiety disorder, GAD. These medications help regulate brain chemistry. Doctors usually start with 20 milligrams daily, and if needed, increase dosages up to 80 milligrams. The common side effects are nausea, headaches, and trouble sleeping, which oftentimes subside after a few weeks. It often takes about 4 to 6 weeks to experience significant improvements in symptoms. You also need to incorporate daily exercises to your morning routine, like deep breathing or meditation. You also need to get good quality sleep and reduce your caffeine and alcohol intake. You can reduce anxiety by managing your stress levels, building healthy routines, staying connected with supportive people, and practicing daily mindfulness. You need to seek professional help if your symptoms last for 2 weeks, or if your anxiety is affecting your daily life, or you can't control your anxiety. Early help is the best and most effective way to recover and prevent the symptoms from becoming more severe or chronic. If this video helped you understand anxiety better, like and subscribe to the channel for more expert health insights. See you in the next video.